Hello, my name is Jennifer Ramirez, and we're talking about the agency from the chapter 24 to 34. Agency the chapter number 24, mark the two part the sentencing, look at A, B, and C opposite to help you. 1988. So the UK launched the lie attenuated is measures mount and rubella NNR vaccine. Chikungunya varicella is a common infectious disease of the child. Number 3, red rabies has an incubation is period ranging from the 4 days to many months. Number 4, the patient remained fever with peaks of the temperature of 39.5 degrees Celsius. And number 5, there was admitted in the 4-day history the influenza died symptom the fever with rigor, malaria, and general malaise. Quite a proportion of patients were recovered from hepatitis B become current of the virus. Number 7, the central part of Africa is in the midst of an epidemic of AIDS. Number 8, measles rubella is most infection during the catarrh stage. Number 9, Lyme disease causes the transmission of B. Borderfairy from animal the main be easily test. Number 10, POO stands for pyrexia of unknown origin. Complete the case report in the patient is in A opposite local A, B, and C opposite to help you. Case 45. On examination, the look outward high pulse rate was 100 per meter. The hand palpable spring. The combination fever and rigors in a patient who has recently returned from Africa, strolling suggests a diagnosis malaria. The incubation period is usually 10 to 14 days. In the case the patient admitted that he had no bleeding, talking, prophylaxis regularly. The diagnosis was confirmed by the presence of parasite in his blood friend. Complete the sentence. Look at A, B, and C opposite to help you. An infection with can be treated successfully with antibiotics is curable. Another word for epidemic in the outbreak. Bacteria in the viruses are example of microorganisms. Someone whose temperature is abnormal in a fever. Number 5, the common infection with staph viral is known as glandular fever. Chapter 25. Complete the table with words from A, B, C, and A opposite. Noun, adjective. Affect, affecting. Anxiety, anxiety. Behavior, behavior. Dementia, dementing. Disturbance, disturb. Suicide, suicidal. Make a word combination use a word from it both. Two words can be used twice. Look at B, C, and A opposite to behavior syndromes, ailing disorder, major depression, mental retardation, personality disorder, psychomotor retardation, sleep disturbance, substance abuse. Complete the sentence and look at A, C, D, and A opposite to help you. Number 1, the way a person behaves is his or the behavior. Number 2, a persistent emotional state is the mood. Number 3, the sudden attack anxiety is a panic attack. Number 4, the form of dementia associated again in the core senile dementia. Number 5, a disorder which is not associated with pathological change in the is functional. Number 6, an idiot will force the patient to repeat unnecessary action is a compulsion. Which symptom of depression was this patient suffering from? Look at C opposite to help you. K 41. A 56-year-old woman presented her GP complaining of the increased training over the past 5 months. She had lost interest and must die. She was sleeping poorly in attending to the walking of Irving, but denied any suicide tendencies. She was dirty in the was passing urine more often. She was earning normally in the way was stated. The patient has 3 other listed symptoms: fire, fatigue, loss of interest, sleeping poorly, insomnia. Chapter 26. Complete the table with words from A, B, and C opposite. Adjective noun. Blind, blindness. Conscious, consciousness. That, dasn't. Defeat, deficient. Known, known. Light hair, lightheadedness. Antares, antariness. Make a word combination use of word from equal. Look at A, B, and C opposite to help you. Double vision, epileptic fit, prodromal symptom, syncoparatat, uniting in continuous visual acuity. A doctor is trying of determine the cause in the lost consciousness and 52-year-old man. Complete the doctor question. Look at C opposite and at the table is 20C pot 1 above to the happy. Do you lose continuous Sandry of graduate. Do you have burning in the tap of the tap? What were it done before you post out? What weren't you worrying or ordering stress all the time? Do you feel dizzy or lightheaded before the attack? Do you lose control of your bladder? Do you notice any involuntary movement while you wearing unconscious? Chapter 27. Complete the table with wrong from A and B opposite. No adjective. Accent, accent. Diminution, diminish. Flaccidity, flashes. Spasticity, spat. Wisdom, wisdom. A doctor are giving instruction to a patient during examination of the motor system identified what the doctor is assessing in each case. Look at A opposite to help you. I like you to relax. I am who's young the mood your arm out and doubt. Monster tongue. Number 2. Can I see your hand? Muscle part and the possible involuntary movement. Number 3. No, I am going to straighten your arm off. 3 to stop me power. Number 4. Can you touch my finger with your and then touch your nose? Go. Not to you again with your eyes closed coordination. Complete the sentence in look at A, B, and C opposite, and the table is 727.1 about to the help you. A Francis hand drove limply to for a ringing anger with the wrist. Breasts relax that are stronger than normal. Number 3. Muscle waiting mean the muscle reduced in the back. Number 4. A tick is a from in the involuntary movement. Number 5. A key is often used to test the Babinski's Rinsport. Number 6. His coordination was for the good, no for rapid itinerary movement. Number 7. A reflex hemorrhage is used to test relax. Number 8. With 17. Diminish it is less than normal. A patient is brought to E and A in coma. And when her name is scoping, she opens the A's book. She does the no answer question or of the intrusion. What is her GCS score? GC is score 5. Eye opening to speak squash 3. Verbal response no. Squeak 1. Equal 1. Motor response none. Equals 1. The plantar reflex. Chapter 28. Complete the table with from A, B, and C opposite in the relaxed form. Verb, nouns, adjective. Cure, cured. Examine, excision, grow, growth, growing, invasion, invasion, ostrate, ostration, ostrati, palliation, palliative, purple, palpation, palpable, sprout, spreading, swar, swarming, slowing. The note below about the patient described and be opposite. Use then to put the sentences 1 to 9 in the correct order. The next paragraph of the case report. Use appendix 2 on page 20 if you need help with the abbreviation. OA temperature 37.8 degrees Celsius. Is number 6 on examination his temperature was 37.8 degrees Celsius. A small film 3 by 4 centimeter most in air supervascular fossa. Is number 3. There was a small film 3 by 4 centimeter most in the right supervascular fossa. Nose is 2 centimeter dimension palpable in both axillary and inguinal area. Is number 7. There were enlarged length nose in both axillary and inguinal area. Oropharynx NAD is number 2. His mouth and throat were normal. P 100 potmeter regular. BP 100 torrid and system settings. Excuse me. And system C is number 8. And his pulse water was 100 potmeter regular and blood pressure 102. System C. And CBS NAD air is NAD is number 4. His cardiovascular and respiratory system were normal. ADB most palpable 3 centimeters below helicostal margin is number 5 on an abdominal examination. There was a most palpable 3 centimeters below the left costal margin. CNS NAD number 1 examination of the central nervous system was normal. Complete the sentence in look at A, B, and C opposite to help you. The less spread or tumor cell is keynote as metastasis. Number 2, many symptoms in the cancer such as difficulty swallowing are due to the obstruction. Number 3, the opposite of painful in the balance. Number 4, a malignant neoplasm is called cancer. Number 5, tumor which do not invade the metastasis are benign. Number 6, secondary tumor are those with the result from the spread of primary. Number 7 is a cure not possible. Palliative treatment that should be given. Number 8, a purple liver surgeon metastasis. Chapter 30. Make a word combination using a word from it both. Look at A and C opposite to help you. Blood stain, brasons, pleuro root, product code, vocal resonance. Rewrite the question using words that are better known to patient. Look at A opposite to help you. Are you cause product? Do you cause of any friend? What color is the spirit? What color is the spring? It is ever in plural. It is ever in yellow. Number 4. Have you ever had hemostasis? Have you noticed any blood in it? Number 5. Do you suffer from dyspnea? Is problem with your breathing? Are the following statements true or false? Give a reason for your answer using your medical knowledge and A and C opposite to help you. Number 1, a parent has a lost cow produce flame. Is true. A product cow often describe a loss. Number 2, carcass are heard when the ancient are neurons false, crackle, such as the presence of fluid in the lungs. Number 3, a patient has a non-product co-product sputum is false. A cause may be no product where there is a no sputum. Number 4, witches are typical fluorescent. False. Waces indicating gnawing of the anchors. Number 5, a pleural route is a sign of asthma. Is false. The sound heard when the pleural surfaces are inflamed is in pleurosis is called a pleural rant. Chapter 31. Complete the description. A herpes zoster. Shinglet. Be replacing the medical word in the brackets with ordinary. English word. Look at A and C opposite to help you. Shingles. Herpes soreness usually start with the pain and soreness. The red spot mature appear they belong into growth of a small blister, vesicle over a particular area on one side of the body. In small patients, new spot lesions continue to appear for 3 to 5 days. The small blister vesicle becomes filled with blood. Postural in the front scalp crus. In several cases, there may be scar cicatrices afterward. Write in the description of the rat or rubella and complete the notes. Look at A and B opposite to help you. The report are scarred pink macule with appear fear begging the ear and on the forehead. The rat spray rattling feet to the throat and the then to the limb. Location of distribution. For behind the eye and on the forehead, then the throat and length. Grouping, scarring, dilation, macule, color pink. Complete the notes for the rat in the photogram and surgeon at diagnosis. Look at A and B opposite to help you. Location and distribution. Widespread on the chest and abdomen. Grouping, scarring. Type of lesion, small macule with some skew. Color pink. Complete the notes for the lesion in the photogram and surgeons at diagnosis. Look at A and C opposite to help you. Location and distribution. Below lateral. Angle of the left eye. Grouping single. Type of lesion nodule. Color white and pink. Chapter 32. Read the corresponding medical term for the ordinary English word and say the kind of forces involved. Look at A opposite to help you. Common word, medical term, type of forces. Brew, confusion, hematory, blood. Cut, as I would, char. Grace, abrasion, blood. Scratch, linear abrasion, blood. Stab wood, penetrating wood, char. Tear, laceration, blood. Close the current were the complete description of the injury shown in the illustration. Look at A and B opposite to help you. There are grass above the left abroad and on the left side of the knee. A contusion of the left side of the lower lid and tears of the left cheek. Breathing a description in the injury shown in the illustration. Look at A and B opposite and at 32.2 about to help you. There is a laceration tears on the left shoulder and inside where occur approximately 6 centimeters in length above the left nipple. Complete the sentences. Look at A, B, and C opposite to help you. Frequent change the position are necessary in the mobile patient to prevent development of abrasion. SAR. Number 2. They had several stab wounds in the abdomen from the night. Number 3. The had number 3, excuse me, he was now unconscious, be heavy blow to the head. Number 4, the words were only superficial and required no treatment. Chapter 33. Look at the conversation and a opposite and complete a note about the Mr. John. Use medical terms where possible. See of frequencies and nutria for 1 year. No dysuria or hesitancy, extreme and little walker. No inconvenience apart from occasional dribbling. Mild the patient description of their symptoms 1 to 7 with the medical term NG A to G. Look at A opposite to help you. I had to breathe every half hour or so. Is B frequency. Number 2, I had scolding pain with the post water. Is dysuria. Number 3, excuse me, I have to get up several times to pass water at night. Notria is notria. Number 4, I had to rush to go to the toilet. Urgency is urgency. Number 5, I had trouble getting started. Is hesitancy. Number 6, I can hold my water incontinuous. Number 7, I pass some blood. Is my urine is hematuria. Read the doctor question for each of the symptoms and 30 to about. Look A opposite to help you. You will need the thing of your own question for urging. Possible question. Frequency. How often is that? How often do you pass urine? Dysuria. Do you have any warning or pain was you pass water? Nutria. Do you have to get up at night? Hesitancy. Do you have any trouble getting started? Incontinuous. Do you ever lose control? Do you control of your bladder? Hematuria. Have you overpaid blood in the urine? Urgency. Do you have to rush your to head to the toilet in time? Chapter 34. A doctor is talking to a patient during otoscopy. Mark the ordinary expression she used and 1.4 two expressions with similar meaning from A opposite AD. Right, Miss Middlegold, because you have behaving the hairs. I am going to have a look at your eyes. particularly the bluff of your eye, the retina. I am going to put couple of drops. Is a topical Mariatrin solution in your age. We will make it easier for me to see the retina. Is C. Toe a dilatation. After a few minutes, you may feel your vision blurring. The we wet offer about the hour. I need to get rid of as much external light as possible. This means causing the blinded is the phases of target. Excuse me. Is A. The examination is done with the 10 lint. Now I like you to look straight ahead and that cloth is faces on a target. And this take the effect meaning and your aging 9 feet averting so you can blink if you need to. I don't want you to look at me. Look at the chocolate. Complete the instruction. Look at be opposite to help you. Breathe a cough around the patient upper arm. Number 2. Place the diaphragm over the area of the bronchial around. Raise the patient arm so that the bronchial around is the same high as the heart. Number 3. Close the venous, the valve on the pump. Number 4. Pump in the pressure to a less 100 feet. Open the valve a little and slowing deflate the cut with listening and watching the pressure gauge. Number 5. The first sound you hear in the flow of blood throughout the brachial artery, the value of the gauge. At that point, instead systolic blood pressure. Number 6. Continue listening will your slowing deflate the cut. Number 7. The diastolic blood pressure is measured when the sound completely disappears. Complete the text. Look at and see opposite to help you. Phlebotomy are especially trained in taking blood. They are scared and venipuncture puncturing the vein to taking blood sample. The brain, hand and foot can be used the more often a vein in the earnest part on the board is used. If you difficulty to locate a cerebral vein, the patient may be asking to make a fix or a tourniquet might be applied of the upper arm and to make a vein more apparent. Afterward dressing is approved and the patient is asked to breathe gently excuse me. This helps to spot the bleeding and prevent bruising on the site. It is important that specimens due are labeled correctly before they are sent to the hematology laboratory where a full blood count of the other investigation will be carried out.